Hey guys, welcome to my channel. I'm Dr. Tanya. Today we're talking about women in orthopedic surgery. So if you're a medical student who's curious about ortho but hesitant because of all the stereotypes and myths around it, then definitely stick around. Orthopedics is kind of like solving a puzzle or building with Legos. The problem solving, the precision, the figuring out how to get the best results with the available material is honestly very exhilarating. In this video, I'll break down real stats, debunk a couple of myths, and also talk a little bit of my personal experience. Now let's look at the numbers for a second. Only 14% of orthopedic surgery residents were women in a study published in 2017. That's just a slightly 11% increase from back in 2005. Now, I couldn't find a study with more recent data, but I'm pretty sure the percentage remains low when we compare it to other specialties. I'm not here to convince anyone. The point of this video is to clear misconceptions, because sometimes myths alone can steer you away from a specialty that you're genuinely interested in. A very common misconception is that you need to be super strong to do ortho, but that's completely false. You don't need to be a powerlifter, and benching 80 pounds is definitely not a requirement. I know I'm probably the last person that should say this because I'm a gym addict and I love lifting weights, but I've worked with so many colleagues with a more traditionally and feminine physique who absolutely excel in ortho. Ortho isn't about brute strength. It's about technique, biomechanics, and like everything in surgery, practice. Sure, there are gonna be very rare situations where full muscle force generation is gonna be needed. Like if you're working solo in a rural clinic and a 6'5" rugby player comes in with a dislocated shoulder of 8 hours old, then yes, you're gonna have a little bit of trouble trying to put the bone back in, but that's very unlikely to happen. Also, you usually have a team with you, and you would use anesthesia, which helps to relax the muscle, making the reduction easier. It's true that half of female orthopedic surgeons used to play sports in college. It is believed that athletic identity boosts surgical confidence, which is pretty cool, but that doesn't mean you need to be sporty or a tomboy to belong. I know incredible women in ortho who are feminine, graceful, who love makeup, and absolutely own the OR. In Mexico, I met one of the top pelvic reconstruction surgeons. She's the personification of elegance, definitely one of the best. Another important point is that ortho is pretty diverse. You have options. There are so many subspecialties you can choose from. And while many women lean toward hand or pediatric ortho, it's not the limit. You have adult reconstruction, you have sports medicine, you have oncology, you have spine surgery, you have foot and ankles, whatever you want. You might also hear that ortho residency is too demanding, but come on. All surgical residencies are demanding. You have to wake up at 4 a.m. to do rounds. You have to stand for hours in internal surgeries. It's intense. But honestly, I think cardiothoracic and neurosurgery are even more physically and emotionally draining than ortho. And yet, between 2000 and 2018, the number of women in those fields increased by 111% and 55% respectively. So again, why would that stop you? When it comes to choosing a fellowship, concerns like having children influence the decision of only 50% of women. The reality is that hospitals and residency programs are offering more support than ever, with maternity leave policies, lactation rooms, and other accommodations becoming increasingly common and accessible. But this might not be the case for developing countries, for example. Still, the majority of female orthopedic surgeons are married and have kids. Now let's talk about another common concern: radiation. Yes, we are exposed to it, but with proper lead aprons, smart positioning, and awareness, we stay well within the safety margins. You can be an amazing orthopedic surgeon and be safe doing it. In fact, orthopedic surgeons can perform up to 800 procedures per year and remain within recommended radiation limits. Okay, next point is confidence. A study showed that women don't lack confidence. They often just believe that others see them as less confident. Many assume that faculty or colleagues think that men are more technically skilled. This mismatch in perception is called pluralistic ignorance. Everyone feels uncertain, but they assume they're the only one, so no one speaks up. This leads to conformity with false norms and self-limiting choices. But here's the truth: women don't lack the ability. They lack the exposure, the mentorship, and the access to leadership. And this really matters. Women are more likely to apply for ortho residency after receiving early exposure or guidance from mentors. Well guys, that's it for today. I hope you enjoyed it. If you're thinking about ortho or you already love it, drop a comment. I would love to know what drew you to it. Don't forget to hit like, subscribe, and I'll see you next week.